Hello everyone, welcome to my show. My name is Merlin Fulcher and this is episode 1. As you can see, here I am in Tooting. This is Aister, who's with me, and we're going to be bringing you all the news that's happened each day, and I'm going to review some cool things we've seen throughout the day. So one of the big stories that's been going on this week is this old man, and he's like a captain, and he has done this media campaign where he walks around his garden, and then that helps to raise money for the NHS. So he's raised something like £12 million by today, which is Thursday, 16th of April. £12 million to go to the National Health Service, and he himself overcame cancer with the help from the NHS. So he's got a very personal story, and for reasons why he wanted to do this, and he's called Captain Tom Moore. It's actually 14 million now. And so in this image we can see him, he's wearing his medals, he's got his walking frame, he's looking great, and he's got some sort of younger soldiers who's sort of paying respects to him, and he's basically raised loads of money for the National Health Service. We have a system here where everybody who works pays national insurance, and that's supposed to go towards paying for the health service, but unfortunately it doesn't always cover what's required. There's a lot of political toing and froing over where the money comes from to cover the cost of the NHS, and obviously we're in the middle of a big crisis, so it needs all the help it can get. There's some debate about whether or not it should be a sort of charitable thing, because the NHS is professional, it's part of the state, we pay for it through national insurance, so there is a kind of feeling like the government should be paying for it, because that's why we pay taxes, and the government should be making sure the money's getting to the right parts of the NHS. But the plain fact is there's lots of charitable initiatives done by hospitals and other kind of support services throughout the country, so it shouldn't be too hard to find someone to donate the 14 what is now 14 million to, and to make sure it goes to helping out during this coronavirus crisis. This man has been sort of dominating the daytime news television for much of today, much of this week actually. Way more media exposure than someone like the Prime Minister, for example, who's obviously recovering from the illness at home. But yeah, I guess it really does set a good example for what people can do at all stages in their life, and I think it's something that hopefully appeals to a lot of people, and sort of breaks down some of those barriers within society, and shows that we can come together in a meaningful way, and possibly put shame to some of the hedge fund billionaires and other people who are being pretty silent. Maybe puts shame to some of the big media tech companies, which have also been pretty silent. And if one person can do this, then we all can. So the next thing I wanted to discuss was this. It's a really interesting image that's being sort of shared around quite a lot, and certainly on social media, things like Twitter, which is very popular in the UK, very popular in London. And this is an image of the Health Secretary, Matt Hancock, and this is at the opening of one of the new NHS Nightingale hospitals, which are these very kind of designed, very in a way photogenic environments, much better looking in a camera than your average hospital, which are overspill and for the intensive care capacity in the UK. So the idea is that as our hospitals, if and when they become overwhelmed with coronavirus care cases, these hospitals can kick in and provide support across the country and make sure that nobody is dying for a lack of ventilator or intensive care support that they need. So it's basically just providing loads of space, technical space, which is highly serviced with these machines and with this staff. Now, this has been done extremely quickly. All kinds of really impressive cooperation between like architectural designers, military, health planners, logistics, procurement experts. It's a really, really good example of basically what can be done if the state is actually able to focus itself on delivering a task urgently. And it kind of raises a lot of questions about all the other things we haven't been able to do over the recent decades. It certainly raises questions about why we can't do as many tests. NHS, for example, is struggling to test enough of their staff. There's a target to test 100,000 people a week in the UK. Currently it's something like 15 to 20,000 being tested. So the fact you can build not just one of these hospitals, several of these hospitals extremely quickly is obviously good, but then it also raises questions about why other things aren't necessarily being done at the same speed and to the same efficiency. Now certainly in terms of the images that come out of these places, it's very impressive. You know, they look really, really good. And I think it was roughly a week or 2 weeks ago they were opening one in London. And I think in terms of the launch, it didn't go very well because there were quite a lot of pictures of people standing way too close to each other. People in the background not really abiding any of the kind of recommendations that are on us right now. So, and also I think in London the health minister was there in person to open it. So here we have the health minister doing a video link, and here you have like a very kind of very obvious attempt to make people look like they're social distancing. So it's pretty clear that everyone's 2 meters apart from on the right. They're actually, those two over there look quite close to each other. It's weird, no one would ever stand like that. Everybody is looking way too formal, and obviously they're looking quite smart. I mean, they're not necessarily the people who actually built this thing. They're looking more like the technical planners or the health managers. There's a few soldiers at the front, but they're certainly looking, I don't know, they don't look like they've just been operating a forklift truck, or they just, looks like everyone's very much there for the photo opportunity, which is totally fine. Because you have to communicate these things, but yeah, you could say there is something quite odd in the composition of the image. There's this very weird air duct that says hot water. What? I mean, that just doesn't make any sense. So surely this is for ventilation, not for hot water. But then presumably when that screen's not there, there might be some kind of hot water station. But again, if you're running a hospital, I mean, things like oxygen are quite important. A sluice is quite important. I'm not really sure about why a hot water station is really going to be that vital in a ward, but maybe it's for making tea for patients. But then again, if patients are that bad, they're not going to be getting tea from the nurses, so I'm not really sure what that is, but a health planner could say. Anyway, obviously this image has been pretty, it's attracted a lot of attention, and there's been a lot of references made to sort of 1984 imagery, which is this classic image of the hate hour that the main character, Winston Smith, has to endure. And then obviously the famous Apple 1984 advert, which uses a very similar kind of image, which I can actually cue up here for you to see. So
today we celebrate the first glorious anniversary of the information purification.
So, I mean, is this us today? There is somebody wearing a mask, which is quite an odd image. I don't know if after this crisis we're going to have to wear grey clothes. I mean, I think the fashion's not quite right. They all look pretty healthy. He doesn't.
E01 people.
And this is some kind of comment on corporate computing, IBM, I guess, Microsoft,
Shall
I don't
talk
know.
themselves to death, and we will bury them with their own confusion.
She's throwing a
We
hammer.
shall prevail.
Bingo. Yeah, so
On January 24th, Apple Computer will introduce Macintosh. And you'll see why 1984 won't be like 1984.
So I mean, a pretty messianic kind of imagery, and I'm not really sure if it was necessarily the intention of whoever put this image together to invoke some very old ad campaign, but certainly it's got people talking, which is probably a good thing if you're trying to get people doing the right thing if you're running a public health campaign, but you also want to reassure people that things are being run and invested in the right way across the country. So those are the sort of two big images which I'm discussing today. And about an hour and a half ago, we had the clap for the NHS, which was way louder here this week. It seems to get louder each time it happens. We have people banging pots and standing out in the street and talking to their neighbours with a good distance between each other. So yeah, really interesting kind of visuals which we're experiencing here, and we'll continue to monitor the situation. I mean, I think for the most part of it, people are getting on with the social distancing restrictions and living their life in a very sensible way, and it's we're hearing in the news reports that the sort of rate of transmission between people is quite low now, especially in a city like London. So I think we've had the lockdown here for about 3 or 4 weeks now, and we could probably have it for another 3 weeks at least, is what we heard today. But I think for the most part people are being super sensible and really getting through it. I think hopefully that will put us on a good footing for whatever kind of economic challenges happen next, because I think the reality is that we'll probably have to be getting some inspiration from Tom Moore. We have to be a bit more communitarian, have to focus on the really important things to get us all through this. But that is absolutely a possibility. I think we've got a sort of changing, hopefully political consensus coming out of this crisis, and we'll be able to focus our efforts in a more balanced way to addressing everybody's needs at this difficult time. But anyway, thanks for tuning in to my first broadcast, and look out for more. Okay, goodbye.